symposium is over. But thank you all for coming today to really think about how we support, the health and well-being of communities as we think about moving and supporting the adverse childhood experiences work that both the state of California, Governor Newsom, and Dr. Nadine Burke-Harris are really moving to support here in Kern County. So please be aware, again, that this session is being recorded. If you're attending remotely, please make sure to mute your microphone on mute so that we don't have any background noise. Definitely want to create an experience where we're able to chat with each other, connect with one another, or ask any questions. If you are having audio issues, please connect via the phone. Also, please make sure that you type your name and affiliations in the chat if you haven't already done so, to just let folks know who's here. Also, please feel free to rename yourself and add your pronouns so that we know how to address you. And so as we think about this work, the first thing that I want to do is to thank our partners, our network of care folks who are working here in Kern County to really support the health and well-being of the communities that we're serving across our county. It's a number of partners that are really moving to support this work. It includes our Medi-Cal folks, community-based organizations, county systems. So really think about how we're working together in unison to really share out the opportunities that we're hoping to create for communities as we mitigate both toxic stress and improve their health outcomes over the long haul. I also want to thank our co-hosts, which is the Kern Community Foundation and Unite Us, who have agreed to be part of our panel discussions today and who have been great partners to kind of share out the information across our networks and their networks to really support a day of learning and innovation as we think about what this work looks like over the next few years. Today's agenda is really going to be geared around both a few presentations where we can learn around what's happening around ACEs here in Kern County, but then also learning around what's happening with ACEs from other planning grantees. And then we'll finally conclude with a presentation and a dialogue really around how are we supporting the ACEs work here in Kern County and how are we leveraging technology through the Unite Us platform to really innovate, think about the social terms of health and outcomes that we want to pursue for communities. At any point in time, if you want to take a break or need to get off Zoom because the Zoom fatigue is real, please take care of your needs. But we'll have a full day of learning to really think about how we're moving and operationalizing this work here and across other geographies across the state of California. Now I'll hand it over to my co-host, Mark Tebot, which will give us a little overview of why we're here today.
Well, thank you, Hector. We are so excited and gratified to have so many of you joining us today, including our peer organizations from other counties. We're here to share the lessons learned in the last few months, but also to provide a forum to discuss these strategies and findings to help advance the ACEs Aware initiative going forward. We have brought together knowledgeable speakers with real-world experience in screening for ACEs, creating clinical workflows, spreading the effort across multiple providers, and creating a referral pathway that captures system-level results to truly understand what works. What we hope from all of this is that you're going to learn from the others through the discussions that we have, that we can build and sustain partnerships, not just in Kern County, but across California. We want to advance the science of ACEs and build new connections that will help us all to advance the initiative begun through the work of Dr. Nadine Burke-Harris, our Surgeon General, and the Department of Healthcare Services. But we also want to learn from you. We want you to be able to ask the kinds of questions and catalyze the change and mitigate toxic stress in communities that overwhelms a lot of our communities at times, but which builds on the resilience of our families that are dealing with a lot of issues. And we'll be addressing how to go about doing that as we go forward today. So thank you all for joining us. We hope you find this morning useful to your own work. And I'll turn it back to Hector.
Great, thank you so much, Mark. So I think one of the things that we want to do first is really share out some of the work that's emerging here in Kern County. We have been engaging multiple partners, but I think one of our partners that has really stood out and has really championed both the ACEs work here in Kern County has been Dr. Rao from Omni Family Health. She is a fantastic pediatrician who manages a pediatric complex care clinic at Omni Family Health. She's been a true champion around how do we think about this work to really support the health and well-being of children who are most vulnerable and are impacted with trauma, adversity, poverty, and a host of other issues that impact their health and well-being. And with that, I will turn it over to Dr. Anu Rao, who will talk about some of the work that she's been leading here in Kern County. Dr. Rao?
Well, thank you so much for that kind introduction, and thank you for the opportunity to share some of the work we've been doing here at our Pediatric Complex Care Clinic at Omni Family Health. Hector's in charge of my slides, so let's move forward to the next slide. So really, pediatric complex care is all about providing good primary care services to patients with multiple complex medical problems. I like to think of this as the ABCs of complex care. The elements are access, advocacy, really supporting caregiver burden, and then care coordination. Next. Whoops. So our Pediatric Complex Care Clinic opened here in October. I am proud to say we are the only primary care clinic that is dedicated to the health and well-being of children with medical complexity. We are a small but mighty team. It's just me, a couple of MAs, and a receptionist. We do have 2 days a week dedicated to primary care services for our complex patients. Next. So really the fundamentals of complex care, the way we think about it, involve these 4 elements: safety, access, care coordination, and supporting caregivers. Next. So this is a slide to demonstrate that some of the work we do, the direct patient care and the telehealth work, is really a very small fraction of the overall care that we provide. These are all the different agencies that we're communicating with, the community partners who we engage with in order to get the services we need to get that seamless care and services for our medically fragile children. Next. So really, I like to think of this as the guiding principle for care of children with medical complexity. It is not enough to just address the medical needs of the child, because the child doesn't live by themselves. They live in the context of a family and are dependent on that family for their basic needs. So whatever program we design has to look at the child-family unit, not just the child. And supporting the family has tremendous impact on healthcare outcome in the medically fragile child population. Next. So it's in this spirit that we started screening our families for social determinants of health. Imagine having a very fragile child who's dependent on technology, has a vent, has a G-tube, has other technological needs, and then having or living in a situation where you have substandard housing, you're getting evicted because you're behind on your rent, you don't have enough food for the family, you don't have adequate transportation to take you to the child's medical appointments, you're underemployed, you're functioning under great stress and great financial strain. Well, obviously, that's going to impact the care you provide to the child, and will impact the health outcomes in that child. So addressing social determinants of health is really key to the overall health and well-being of the child family unit. Next. So this is the screening tool that we've been using from the AAFP. It works well for us, and we've had a good success with it. Next. So the SDH screening highlights the areas of concern, areas of needs expressed to us by the families of our patients. And now it is our responsibility to link these families to appropriate community resources. So until a few months ago, the way we did that was, well, we accumulated a binder of resources just based on what we knew was present in the community. It was something that we put together based on our knowledge and consultation with other agencies, but it was certainly not comprehensive. It was extremely time consuming because each referral had to be individually placed, phone, fax, or email. And then we had no way of knowing the outcome of that referral. Not to mention, there was no way for us to really look at the big picture and analyze our referral patterns to see where the needs were that we could address better. And then came Unite Us. We started to pilot this program in our clinic. It's web-based. We found that it was extremely easy to use. We could submit a lot of referrals at one setting, and they were acted upon rather quickly. The other good part about it was we were able to track the referral from start to finish. And as you noticed in our clinic setup, we don't have the luxury of having a care coordinator. Many primary care clinics do not. So this filled in that role for us as a virtual care coordinator. So we were all able to submit this and use this as a care coordination tool. The thing I like about Unite Us is I get reports on a monthly basis that they inform me about my referral patterns, the needs of my patients. So that is something I learn from constantly to see what we can do to better address our patient needs. So we are a pilot program for Unite Us. We've had great success with it, and our hope is to implement it throughout our organization. Next. So this is the sample of the report that we get from Unite Us. It tells us who are the people, who are the organizations we're referring to the most. And it also tells us what the needs are. Look at this, food insecurity, huge. Income, financial strain, huge. So this is really an eye-opening experience to be able to see the referral patterns and the needs in this format.
Dr. Rao, this is Kendra. If I could just pause real quick. First, I want to just say you've been amazing. So thank you for your leadership and your willingness to just dive in from the beginning. I met Dr. Rao right on her last day of vacation, and she was like, no, I want to do this. I'm ready to dive in, and spent her time doing that. But to her point about food insecurity, we have CalFresh enrollment in our state that is underutilized, especially here in Kern County, throughout our Central Valley. we have low utilization rates. So when we see things like this, where we have really high need, we also have those service providers on the network. So this is where we would love to kind of ultimately go, right, is how we use this data that Dr. Rao was seeing in real time to say, Dr. Rao, how can we best meet the needs of your patients? We need more food partners. We need more things like CalFresh and WIC. So that is kind of our hope, is that we're then able to actually use this data to inform where we need to do our work as a network to make sure that there's more partners on board that can meet the needs of those patients and clients.
Thank you so much, Kendra. We have a short time span and we have question answers at the end, if you'll indulge me. But thank you so much for your comments. Next slide, please, Hector. So the other thing with Unitas, Kendra, that I'm really excited about is that I think it has the potential to be a very powerful health equity tool. It gives us information on, gender, age, ethnicity, and that I think overall has the potential to impact healthcare on a large scale. Next, please. So this is something that really makes me happy. So these are the top referral centers in Kern County. And there we are at the Pediatric Complex Care Clinic, one little clinic with one little team, right out there with some of the major organizations in terms of the number of referrals we've submitted. This makes me so happy because it's very encouraging. You don't need a big team to do this. You can do this in a primary care setting with a limited number of team members, as long as they are dedicated to this and who believe in it. So to me, that this is a very powerful message, that this is something that could be replicated in any office in a primary care setting. Next, please. So this is just a reminder to rest your eyes. I hope all these demographics are not giving you eye strain. This is actually a museum in Iceland where I just was, and I thought it was kind of a cool display. Next, please. Moving forward to adverse childhood experiences, I don't have to tell this group, obviously, about ACEs. That is a unifying theme for all of us who are here today. ACEs, as you know, is focused on history of abuse and neglect and certain household challenges that occur in childhood that have significant impact later on in life. Next. So this is the traditional ACEs survey that we all know and love. Next. So again, I'm preaching to the choir, but the toxic stress that you experience in your early development due to these stressors causes a persistently high cortisol level in your body, which ultimately translates into reduced lifespan and disease states that really have nothing to do with mental health. These are independent risk factors. In children especially, there's data indicating that there's a lot of emotional dysregulation, learning issues, risky behaviors related to high ACEs scores. And we also have to remember that the epigenetics of this situation, where toxic stress can actually alter your DNA and can be transmitted through generations. Next, please. So some words on where we are as an organization at Omni in terms of implementing ACEs screening. In 2020, Omni has required all primary care providers to be ACEs certified. That has happened. They also incorporated ACEs as a screening tool in NextGen, which is our electronic medical record system. So it's easily accessible by providers. And then obviously the billing codes and stuff have been uploaded into our system. More recently in April, we had a Lunch and Learn conference for our primary care physicians. It was dedicated to ACEs, the importance of ACEs, the importance of screening for ACEs. And then also at the same time, we've initiated training for our ancillary staff, our medical assistants, and our front office staff. Next slide, please. So to date, this year, there's a total of 3,500 screenings done by Omni primary care providers. And most of the screenings are negative, only a small portion are positive. So to me, that is an underrepresentation of the level of toxic stress in our patients, and that's something we'll touch on later. Next, please. So the barriers to universal screening in primary care, this is a very informal poll. I called a bunch of coworkers and I asked them, what is preventing you from doing more ACEs screening? I mean, Omni has 135,000 patients and we've got 3,000 screenings, right? So what is it that's preventing people from screening more? Almost universally, the answer is time. The visits are too short, too many things to do in one visit. It's jam-packed. What screening do I focus on? There are so many screenings that these patients need. And then the office staff, sometimes who are tasked with initiating the screening, they forget because they have a whole list of things to do. And then my favorite response is one of the providers is, what is ACEs? So again, there's just tells us how much more work there is to be done in terms of understanding the importance of ACEs, believing in it, and finding ways within a busy clinic to incorporate ACEs screening. Next, please. So with that, I would like to turn it over to Antonia Molinari, who is a medical student at Touro University. Antonia was crucial in implementing ACEs and SDOH screening in our pediatric complex care clinic. And she will talk in detail about how we were able to successfully incorporate ACEs screening into our clinic workflow. Thank you very much for your time.
Great, thank you so much, Dr. Rao.
I'm having some technical difficulties associated. Are you still able to hear me just fine?
Yes.
Yes, wonderful. Okay, so hi, my name is Antonia. I am a fourth year medical student who had the wonderful pleasure of working with Dr. Rao during one of my clinical distinctions in my third year. I'm currently applying to my pediatric residency as we speak, and I'm very grateful to be able to share what we learned. We implemented ACEs as part of the research study where I was investigating social determinants of health and its effect on caregiver burden within her clinic. Next slide, please. So to start off, I wanted to show the screening survey for ACEs that we use within this clinic. We ended up choosing the identified version of the screening survey. There are both de-identified and identified versions where you would mark which category you would fit into. We found that having the identified version was better for our population base because when families were offered the de-identified version, they sometimes had difficulty tallying scores at the end and would often frequently still mark which question they had applicable to them. Next slide, please. And so to first show the suggested pediatric workflow for ACEs, this is from the ACEs Aware website. I want to show this at the beginning to kind of show how we deviate a little bit and apply it to the pediatric complex care clinic. Next slide, please. And also to give a little bit of a preface, these are some of the current challenges and barriers within this complex care clinic that we considered, and we will go through each of these individually towards the end once you see how we reached our current workflow that we are applying. Next slide. So to start, at the very beginning, we wanted to assess how receptive the population was to ACEs screening and social determinants of health screening. The way that we implemented this, and by we, I do mean me for this portion, I met with a couple of the families within the clinic who I had interviewed as part of my original study, and then followed up via telephone to see what they thought of the social determinants of health screening and the ACEs screening via the phone. What worked well with this method is that it was separate from the workflow, and so it didn't affect clinic time significantly. It was flexible to adapt to family schedules, especially when they have high complexity needs that require frequent daily maintenance. However, what we did learn was that it's very impersonal and not significantly appropriate for ACEs screening due to the sensitive nature of the topics discussed. But we did learn a lot, and so we then considered, if you go to the next slide, we very briefly considered using the parent ACEs score as an estimate for the child ACEs score. We initially considered this because we were a little bit concerned about how applicable the ACEs survey would be, given that children with significant medical complexity, some of them have developmental delays and they may not apply to all the different questions asked. We ended up finding that this is not the way to go before we even implemented it for a couple of reasons. The first is that we felt if we were going to address a parent's ACEs score, we should have the resources and relationship available to be able to help the parents address whatever was brought up. And since in this pediatric clinic, we don't have that type of physician-patient relationship with the parent, it wouldn't be appropriate. Additionally, we want to avoid assumptions that the parent ACEs score would be an accurate representation of the child's ACEs score. And that is why we did not end up pursuing this method. We moved on to the next method. So this is one we found that worked relatively well. It started with a detailed explanation. Specifically, I would have explained ACEs and SDH screening with Unite Us during the office visit at specific times that I identified. I would allow the parent or caregiver to ask any questions that they have, as well as fully explain why we're doing it and how it can best benefit their child. We learned that this was more effective and improved participation rates compared to the phone follow-up. It also gave us an opportunity to address literacy barriers, and that some of the families may not be able to read the surveys, and so it gave me the opportunity to be able to verbally relay the survey to them. And it also gave us adequate debrief to explain why and everything about the surveys within the same time span. Downsides to this method was that it was time consuming. It would not be sustainable long-term without additional staff. And we still were a little bit more concerned about honesty on surveys when asked questions directly. But a big thing that we learned was key points during the clinic workflow when patients and their parents can be screened. Specifically during registration, when they're first roomed while the medical assistant does the intake and vitals, as well as at the end of the visit if they're willing to stay later. Move on to the next slide. In order to try and be a little bit more cognitive of maintaining the adequate flow of the clinic, we tried to find a less interruptive method, and this included having the screening surveys incorporated as part of the registration paperwork that parents were given upon checking into the clinic for their appointment that day. Specifically, we had the ACEs and the SDOH screening with Unite Us in separate packets with a specific cover sheet warning and cautioning about the sensitive topics discussed on top of each, and they would be included with the other intake paperwork that they were given. Pros to this method was that it fit very well within the clinic workflow with minimal interruptions, given that the parents were already filling out paperwork at this time. It did increase the response to the social determinants of health screening significantly. However, we still did not see a large increase in the amount of ACEs responses. It also gave parents some more privacy to complete the surveys, and unfortunately did not help families with literacy concerns. And so we ended up moving to a different workflow. However, this did show us that having a receptionist who was informed about what the screenings are, as well as being able to answer any questions within the front office, was very important for successful implementation of this method. And another main lesson that we learned was that families that were more familiar with ACEs were much more likely to complete the screenings. This was seen a little bit more in the detailed explanation portion as well, the previous method, but this was further reiterated here in that families who came in already knowing about ACEs often filled out the screening without significant prompting or explanations required. Next slide, please. These are samples of the cover sheets that we used. We included both English and Spanish versions because those are the two predominant languages within this population base. We tried to keep them short and to the point to not overwhelm the families and parents with very long explanations that they may not end up reading after all, while still maintaining the caution at the bottom, just so they kind of know what they're going to be reading right after the page. Next slide, please. And now on to the wonderful current workflow that is still being used in this clinic. We're going to start with the blue kind of loop first and then move on to the yellow. Specifically, this method combines the detailed explanation with the screenings at registration methods into one kind of seamless model. Specifically, having the survey still offered upon registration and when they first come into the clinic, and adjusting to whether or not the parent completes them when first given or later on. So in the ideal situation, the parent, number one, as you can see in the blue, completes both screening surveys. And once room, the medical assistant updates the electronic medical record, adds the ACEs score, other areas of social needs identified in the screenings, and as well as the vitals and other intake process that they do. Moving to the physician's role, who prior to going to see the patient would review the chart as well as ACEs score in social determinants of health positive regions, would add discussion of ACEs and treatment for ACEs in addition to the regular office visit and connecting to the social resources available through Unite Us. That allows us to start helping families from the very first visit and is our ideal situation. In this population, we are still working on having that significant participation at the very beginning. And so we have adapted to incorporate a more detailed explanation, which had some success if the families do not complete the surveys at the beginning. Specifically, if you look at the yellow, when parent 2 does not complete the ACEs or the SDOH screening, the MA still takes the paperwork, updates the EMR, adding the vitals and other stuff during their initial intake. But here, the physician's role reviews the chart, continues with the treatment prescribed, but takes the opportunity to discuss ACEs and social determinants of health during the office visit, answering any questions that they had, and then either connecting to social determinants of health, like resources through Unite Us, and following up on that. And this would allow them to then readdress ACEs at the subsequent appointments once more trust or a better relationship has been formed. We find that this works well because it does incorporate the education aspect that seemed to be very beneficial with implementation of screenings, while still allowing those that might be a little bit more familiar with the screenings to complete that if they feel comfortable at the beginning. And then if you can move on to the next slide, we'll talk about the major things that we learned. First, with the barriers and challenges that I prefaced before, to address the language barriers and the literacy barriers, we have all materials offered in English and Spanish and easily available to anyone who desires them. We find that having them in equal access does not kind of promote one or the other, and so families can take what they need. Additionally, to address the significant literacy concerns within this population base, we're having the medical assistants offer to verbally read the surveys to the families and dictate or document what they would respond to the surveys, and that has been successful as well. And then I underlined this one because I found it to be the biggest one from what I noticed during my time in this clinic, was the lack of awareness of ACEs. Families and even the clinic staff were unfamiliar with ACEs prior to the implementation. And since we found that almost every family who was aware and understood ACEs prior to me presenting them with the survey filled out the survey, we find that if we address this major barrier first, it would have a more successful implementation earlier on than if we were to address that type of lack of awareness later on. And we'll talk about more of that for the suggestions in the next slide. But our other concern was the number of staff. As Dr. Rao mentioned, there is a limited number of staff in this clinic, and me being an extra body at the time was able to kind of adapt and implement the surveys. But now, since my time, my rotation did end and I have limited time to be able to come back, we worked to adjust the workflow to incorporate existing numbers, but are optimistic that if staff numbers were to increase, we would be able to do more, but we make do with what we have. An additional concern that we had was the independence of some medically complex children, specifically whether or not the surveys would apply to these populations. And thankfully, and fortunately, what we found was that it was not really applicable. We did not find as much of a concern with this when we implemented the surveys, which was very good to see. Next, we talked about caregiver burden and how these families often have a lot of appointment fatigue as well as paperwork fatigue. Specifically, there's needs to be more research into the effect on implementation, but what we initially noticed is that we can't rule out that caregiver burden did not impact the low participation initially with some of the methods, and are hoping that as they continue through this clinic and we're able to get their needs met, this will be reduced and families will be more willing to engage with the surveys in the future. And lastly, one that I was initially surprised about was truthfulness in the surveys. We found that sometimes often the families were not truthful. And as what Dr. Rao mentioned, the low number of high risk reported ACEs score does not significantly match what we see in the clinic. We're still trying to find a way to build enough trust with these families and to allow them to feel more comfortable sharing, specifically by considering having social determinants of health screening done first, and then introducing ACEs or providing the ACEs screening at subsequent visits once the family might feel more comfortable opening up. If you move on to the next slide, please. And then for the last slide, suggestions with implementation moving forward. What should other clinics know to better start their implementation based off of what we learned and our goal? We want to share what we learned so other clinics can have a much smoother implementation. First and foremost, given the significant improvement in responses based on awareness of ACEs, start increasing awareness of ACEs within the clinic and why we screen, so families are more familiar before we start implementation. Specifically, what we're doing is implementing or incorporating posters, pamphlets, and other resources in the waiting and exam rooms in both English and Spanish, our two predominant languages, so families can read at their leisure or while they're waiting for the providers. ACEs Aware has had numerous materials on the website and handouts available to the clinic, directed towards providers, and even materials directed towards families that families can take throughout the office visit. Secondly, is we notice having the entire clinic staff informed and on board with ACEs and implementation can help with a smoother transition to incorporating it, specifically allowing any clinic staff member to be available for questions or help with translations as needed. And then lastly, what we noticed was having established rapport with families early, considering to implement social determinants of health screening first, and having the referrals placed and followed up on can build trust and a stronger physician-family relationship, and then allow you to successfully introduce ACEs screening at the subsequent visits. Those three key points, I think, will help any clinic moving forward. Next slide. Dr. Rao, you'll come back over. Okay. Thank you very much.
Oh, well, that is the end of our presentation. Thank you so much to Omni Family Health for giving us this opportunity with our pediatric complex care program. First five, Mark and Hector, you are awesome. Antonia, you will make a fabulous physician one day. And also big thanks to KCCN.
Thank you so much, Dr. Rao. We do have about 10 to 15 minutes for questions or Q&A for folks that are on the line. So if you can either put it in the chat or raise your hand so that we can call on you. Want to create some space to really think about, kind of share out some of these lessons learned. So I see Teresa Alvarado, your hand. Go for it. Ask your question.
Okay. Hi. So one of the questions that was posed by the last speaker was about truthfulness in the answers. And I think that the first time I ever saw the ACEs questionnaire, it made my hair stand on edge. Probably because I knew my ACE score was quite high. I'm 64 years old, and I'm sure my parents didn't know how to be parents. So I think that a lot of times that's the reaction that we have when we see the ACEs questionnaire.
Thank you for sharing that, Teresa. And I had the same response when I first filled out my ACEs questionnaire. I mean, it takes a lot of trust in sharing this kind of personal information with another individual. It really does. And there needs to be that trust building and that relationship for folks to open up. But we should at least try.
Yeah, and so my point was going to be this. Then as an adult, my very, very first job, I was a paralegal. And we, at a legal aid office. So if anybody knows what legal aids do, it's what the clinics do, but for the legal issues that family are facing. And I think my suggestion is this. When you're encountering people, address their immediate needs. That's why they're there. So when I go to the doctor, I want them to take care of my medical needs. But I also want the doctor then, or the front office, or like you said, the information that I'm able to read at my leisure, then that is what's going to point me to what more can you do for me? Understanding that if I have a need to go and maybe speak to somebody privately about physical abuse that I'm encountering, or any other subject, then I know where to go to, and making sure that that open door is there. But I think that the reason why a lot of times we encounter that first hesitancy, I don't know so much that it's trust. I trust my doctor. If I didn't, I would have seen him one time and never gone back to him and picked another doctor. I trust my doctor, but I'm not sure that I want to talk to my doctor about some of my personal issues. So
exactly.
So thank you for the work that, yeah. So thank you for the work that you're doing. And I think that just by letting people know, either by material or that you're putting out or anything else, I think that they will come back to you when they need you.
Thank you.
Yeah, thank you, Teresa. Stacy, you have a question? I see your hands up.
Oh, okay. Oh, I'm sorry. I'm a visible person for the moment, but there was a quick thing I wanted to add. I saw a couple comments in the that involved how one person's physician asked about just the score and not marking which one. We did briefly mention on how families struggle to do that, either due to literacy concerns or being able to tally up the numbers within their head. And found that even when we offered them to just write the number, most of them still checked the boxes. And then the other comment that I saw in the chat was addressing, oh, my brain is making on it. I'm sorry, let me pull up the chat quick. There was two things I wanted to briefly mention and address whether or not we think ACEs are being answered truthfully because it may be triggering and or the result from CPS. I think both of them apply. When interviewing families about how they felt after the survey, just to kind of gauge what their reaction was to initially reviewing it, I think it may be a little bit of both. I think there may also be a little bit of denial associated where some parents may not want to acknowledge the type of situation that they may be in. And so I think it's definitely a multifactorial, multiple factors at play into why families may not be truthful on the first survey.
I wanted to say really quick that I was
Chantel,
asked.
Chantel, Chantel, I had
Yeah.
Stacy Hudson, but I can get you right next. So Stacy, do you
Okay.
want to ask your question?
Go ahead.
Sorry about that, Chantel.
Well, it's kind of, the conversation is kind of happening. It's kind of unfolding. But there is that, there's this talk about trust, and there's this concern, I think, that our society still is very reactionary when it comes to experiences for children that are, kind of can be considered abusive, right? And then the different cultural elements at play for different families. And so that fear of, if I talk about this, someone's going to come take my child away or tear my family apart. And so I think that, maybe introducing this screening right off the bat when you haven't even built a relationship with a patient isn't the best path. Maybe the relationship needs to happen first. When we look at how we address trauma, relationships is in the forefront, right? The most determinant factor of resilience is relationships. So maybe that screening needs to be held until that doctor and that patient have had a chance to build that relationship, even if it does mean we don't get to address those issues right away. We will address them eventually. It just, I think, what about that idea of just let's maybe bring the relationship first? What is your guys' thought on that?
I think that's very much true. A large portion of the patients in our clinic have a pre-existing relationship with me. There are some brand new ones, and certainly in those, it was important to build that trust first. Cultural factors are huge, I have to say. And part of the SDH screening, actually, identifying those areas of need and reaching out and helping, and the family seeing that effort on their behalf went a long ways towards opening up about ACEs, because in a way it was a trust building experience. They shared their SDH needs with me, which is a personal thing. And if we were able to mitigate that in some way through our referrals to community resources, that kind of solidified that connection. And it helped towards the ACEs survey.
Great, thank you, Dr. Ra. So I have Chantel and then Carson on the queue. Chantel, do you want to ask your question? We have about 5 minutes left, so I want to make time for.
I didn't really have a question.
Okay.
Because I don't have one. But
Okay.
I wanted to say that I was asked those questions because I'm actually a parent. So, the ACEs gets me sometimes, but I do see the purpose in it and I do understand it. But I do think that the relationship is important first, because when you ask impersonal questions to a family who is already going through a lot, you may not get a clear answer because they're already going through a lot. So the first thing they think is why should I put more on my plate when I don't know if I can handle already what I have? And then they don't know who they could trust because too many people aren't giving them the medical advice that they need in order to care for their children. So now, where Dr. Rao might get like a backlash, or a parent that doesn't want to communicate as much. And she could really help with all these different services, but they're just resistant. So I also believe that everyone has to be on one accord in order for it to work, because when you go from place to place to place and people aren't using it, then the parents are going to be more confused.
Thank you, Chantel. I think that's a great point around making sure that we have parent education and resources so that we're all on the same page. Carson, I saw your hand up. You can unmute yourself and ask your question.
Yeah, thank you for taking time to do this. Question for Omni is, with rollout, going back to square one, do you have any staff who maybe had reservations about doing this because of ACEs themselves? This is something that was posed to us, and if you had any strategies to address staff who may have their own experience with this, who make them uncomfortable asking patients about it. Anything about that? Thank you.
Thank you for that question. Yes, it is triggering for the staff as well, especially if they have to go through line by line in a literacy challenged patient. That can be very distressing. We have a very strong behavioral health department available to assist. I haven't personally encountered that in our staff members. We're a very small group. So I can't say that I've encountered that, but it is inevitable. I think that there are resources internally available to help that staff member with that triggering.
The one thing I wanted to add to this, sorry, some floating head, was basically, so when I introduced the topic, because I educated the staff about ACEs during the implementation, and so a lot of them had the initial shock of, oh no, what's my ACEs score? And so being able to provide a lot of the resources that I had on hand from ACEs.org allowed them to kind of ask me questions about what it meant, what resources were available, and I had those materials on hand to give them, ended up to kind of reassure a lot of their fears and how it's not everybody that has that ACEs score. And it's not a confirmation that you're going to have poor health outcomes for sure. But I found that the more education and the more that was discussed as a group, the more comfortable they felt with implementation and being able to translate or ask those questions of patients. Does that help a little bit?
The other thing I'd like to add is in the training sessions that they've been conducting, there's a big emphasis on self-care and knowing your risk factors and encouraging folks to reach out and be more self-aware and address their own ACEs.
Great, thank you, Dr. Rao. So we have about 3 minutes left, so I want to give Lucy Mata time to ask your question and Mark T-Ball. So if you guys could ask your question, then Dr. Rao could simultaneously answer those questions. So Lucy, go for it.
Thank you. So I would like to learn a little bit more about the process once you've identified that there's a need and you've kind of made that resource available to the patient. Do you get any hesitation on the patient's end? And if so, how do you deal with that? Or how do you approach that again? So if you identify that there's a need for food insecurity and you've made that connection and that resource, are you finding that most patients are using that resource that you provide, or is there some sense of hesitation there, and what you think that hesitation may be, if so, and how you work around it?
Thank you for that question. Well, the response to community referrals has been great. They appreciate the fact that they were referred and they report the benefits of that referral. In terms of the fears, the biggest fear in our patient population is the legal status, the need to show papers. And that is a big deterrent in terms of applying for programs in which for which they are eligible, and also for any kind of, and that generalizes to any kind of service with an organization that remotely smells of, the state of California or the government. So we really do spend a lot of time, telling them that that is not our, that is not something we will ever divulge to anybody. And there are some programs that they are, that we recommend they stay away from for these reasons, but we do our best to protect our families. In general, if that's a concern, we have kind of a way of noting it without really noting it. So we tend to steer clear of any kind of referrals that might jeopardize that status.
Great, thanks, Dr. Rao. Mark, do you want to ask your final question and then we can move on?
Just real quick, I know that you've spent in the past many hours advocating and finding services for your patients with the Kern Connected Community Network. Are you saving time and getting better results?
Yes, absolutely. I'm saving time and I'm getting better results. And I can see there's a transparency to that process in terms of what worked for a patient, what did not work for a patient, and what the outcome was, which I appreciate. There's also more resources that I can look up in the community as opposed to just word of mouth or something we share between colleagues.
Thank you.
Thanks.
Thank you so much, Dr. Rao and Antonia, for sharing some great work that you all have really been championing and moving here in Kern County. You know, just the number of referrals and data that you're all collecting to really make informed decisions speaks to the volumes and opportunity that we have amongst ourselves here in Kern County as we think about a more coordinated, connected network of partners working together to really support the health and well-being of communities. And so I appreciate all the work that you do. I love that we're partners in crime to really help communities and really shift the conditions that are continuing to perpetuate inequality within our communities. So I commend you on all the work that you're doing, and I look forward to seeing how this work evolves as additional providers in Omni leverage the Unite Us platform to really make an impact and an dent on the resources that are connected to communities. So thank you for your time.
Thank you.
And so with that, folks, definitely a lot of learning, right? A lot of questions that are coming up as part of the discussion. So if you have additional discussions that come up, please make sure to put them in the chat. We're going to capture them and try to answer them as best we can. We'll have some additional time also at a later time to really think about discussions when we do breakout and conversations. So the next part of the agenda is really an ACEs panel discussion around lessons learned from the field. We've brought together other ACEs planning grantees to really think about and share some share some information around how they're going with their kind of planning grant and some of the work that they're evolving in their community. As the kind of theme of this media is really to think about connections and kind of learning opportunities to create some synergy amongst our partners, we thought it would be appropriate to bring forth the East Valley Community Health Center, Partnership for Safe Families and Communities from Ventura County, and some other partners, and the Hillsides from Los Angeles. Information for these folks will be provided. We have Skylar Hansen from East Valley Community Center, who will be sharing about some of the work that's happening in Pomona with their trauma-informed care network. We have a number of folks from Ventura County, Sharon, Denise, and Santa Greeny, who will be sharing a little bit of what's happening with the work that they're doing in Ventura County as they're moving their ACEs work. And then we'll have Hillsides, Laura Jimenez, really kind of talk about the work that they're doing in LA County as they're bringing together, their agency to really support ACEs and what that looks like in communities. And so the conversation will be a panel discussion where we'll ask different questions around how's it going, what lessons learned can we gauge from the work that's been evolving over the last 9 months and where we're kind of going from there. And so I'll start pinning folks on the chat so you can do the view so you can see the kind of panel version. But first, want to kind of let folks introduce themselves and then kind of introduce their network of care. So if we could start with Laura, that would be great.
Hi, everyone. My name is Laura Jimenez with Hillsides, and I'm the Network of Care Manager, basically managing the ACEs 2.0 grant that was awarded to Hillsides as the lead entity. And we had partnered up with White Memorial, Queens Care, Eastmont Community Center, and Child Development Consortium of Los Angeles. And we're basically servicing the East LA community of Los Angeles County, where, like Dr. Rao said, there's a lot of immigrants with referrals that are needed, and they're afraid to step up and get those services because of repercussions. And so we're trying to break those barriers by creating this network of care and surrounding them with services that they can confide on and that they can feel comfortable with in their area and in their community.
Great, thank you so much. Skylar, do you want to introduce yourself and your network of care?
Sure. Good morning, everybody. I'm Skylar Hansen. I'm the program manager for our network of care. We're located in Los Angeles County, very east, almost to the San Bernardino border, out in Pomona. We call our network pattern the Pomona ACEs Trauma and Resiliency Network. We are made up of East Valley Community Health Center, which is a federally qualified health center. We're focused on the Pomona one, but we do have other health centers in the San Gabriel area. We also do have an academic partner, that is the Claremont Graduate University. We also work with Tri-City Mental Health Services, who is actually round one grantee for ACEs Aware. So they've been really helpful because they've already gone through this before in a different setting. And our last partner is Community Translational Research Institute, a local nonprofit that specializes in health prevention work for chronic health diseases. And we'll get into a little bit more about what we're doing in the panel, but it's so nice to have you all here to listen.
Denise, do you want to introduce yourself, your network of care, and some of the partners that you brought onto the panel today?
Good morning. My name is Denise Fritsch, and I'm the care coordinator for the Network of Care Design and Development grant that was awarded to the Child Abuse Prevention Council here in Ventura County with the Partnership for Safe Families. We have partnered with our local Help Me Grow and First Five to design and develop this network of care grant in our county. And today with us is Senta Green and Sharon Elmansdorp with First Five Ventura County and Help Me Grow. So I'm going to pass it off to Senta and let her take it from here.
Awesome. Good morning, everyone. It's both an honor and pleasure to be here with you today and to be with my team. Super excited to share in community with all of you around a holistic model that we have deeply embedded ourselves in through ACEs Aware. And we're going to go into some high level and mid-level and ground level thinking as we're thinking about our ACEs Aware model. And hopefully it will inspire you, encourage you, and help us all think more deeply about the services and work we're doing on behalf of children and families to radically change what's happening in our state concerning our children and families. So we're super excited to be here to share with you what we have to share, but equally important to learn from all of you as well. So I'm going to toss it over to Sharon Elmansdorp, and she'll tell you a little bit about herself.
Thank you, Senta. Good morning, everyone. My name is Sharon Elmansdorp. I'm a program manager with First Five Ventura County. I'm the lead for Help Me Grow Ventura County and also involved in obviously the ACEs Aware work in the county. We will talk more about our design, our model, but what essentially we're doing in Ventura County is taking the Help Me Grow model, which is providing linkage to families who have concerns about their kids and expanding it across the developmental lifespan. So whereas First Five is only working with 0 to 5, our planning grant, we're looking at working with children and adults, again, across the lifespan. We also utilized our network that we already had in place, and we're lucky in Ventura County that we have a very strong network as it is. And so part of, even though we're the only funded partner, we are working very closely with Ventura County Public Health, the Ventura County Health Care Agency, which includes many FQHCs, as well as our managed care plan. We only have one, we're a county organized health system, Gold Coast Health Plan, in implementing this planning grant.
Great. Thank you so much for that introduction, folks. I know there's a wealth of knowledge in this kind of panel to really think about what's working, what's not working. So, I definitely want this to be a conversation amongst all of us. But, the first question is, what have been some of the initial lessons learned from moving the ACEs work forward? What have been some of the growing pains, challenges, and opportunities that you've kind of leveraged? So, anyone can figure, Skylar or Laura can to jump the conversation.
Sure, I can start with that one. I think first and foremost is, we're in the community of Pomona. It's a very large city in Los Angeles County, lots of low income. So we knew there was a need and we were really passionate about applying for this grant. And we definitely, when we wanted to expand our network of care to different partners, we're learning partnership development takes as long as it takes. It cannot be rushed. We usually, when we reach out to someone that we think would really fit this network of care, we start with that initial meeting with maybe the person who would be in charge of doing that capacity role. But it's never just that one meeting. It's always going to be subsequent meetings. There's always going to be additional questions. Our organization did sign a proposal with the Unite Us platform. So when that's just one more thing that we're talking to our partners, and it depends on our partners because a lot of questions come up about what the Unite Us platform entails. We reached out to one of the domestic violence agencies in the community that we thought would be a really great addition. And we were explaining the platform, and they needed just a little more validation that, that all the information would be secure to protect their clients' confidentiality. So we've been working with Unite Us to connect agencies to really validate their decision. But that's one of the lessons learned from us so far is just, it's a 6-month planning grant that got extended 2 months. And every partner is at a different level. Some are super on board from the first meeting, and some need to circle us around their organization. So like I said, it takes as long as it takes, and that's what partnership development and getting that trust is all about.
I can follow up with that, Skylar. It was great to partner up with all sorts of different agencies in the community. And I think this topic has already been brought up, but I think one of the lessons we learned initially is getting the ACEs champions, the people that are going to be delivering the screening, comfortable with the screening and the wording, and how to properly have that conversation with our clients in the community, because as you guys know, it has a lot of delicate information. And so I think that's one of the things that we learned, is that we needed to focus on the training of the people who are going to be giving the screeners, so that they're comfortable with the language and with any questions given to them after or before the survey. And if they're not ready, if the clients are not ready to answer the survey, then also have that conversation with them that, respectfully, we know you're not comfortable when you are, we're here to help you with that as well. And I think that's one of the biggest lessons we learned, giving that support and the training from the get-go of the planning grant, so that they're comfortable when the rollout of the pilot comes out.
Great, thank you, Laura. Santi or Denise, anyone for your team want to share?
I'll chime in, and I would encourage my team, as things percolate for them, to please chime in as well. I want to build off of what Skylar and Laura was sharing, because it seems like there's a lot of synergy around partnerships and collaboration, and we certainly found this to be true. So one of the things that we would say up front is this idea about having mindful strategic collaboration in the community and leveraging systems that are already in place, which brought us to partnering with Help Me Grow and First 5, and really thinking through what is working exceptionally well in the community, but then what are the gaps? So with Help Me Grow, for those of you who may be aware, it is, and not aware, it's a birth to 5 system. So when you talk about care navigation, we're talking about birth to 5. We began to look and see where's the gap in 6 to 11 years old, let alone conception all the way through emerging adulthood, was a significant concern in our area. We were missing some pockets. And so what we did is that we partnered with a brilliant agency that was already doing deep, incredible work, Help Me Grow, and looked at their systems, and then started to co-evolve, co-inspire, and co-develop what a holistic model could look like in our community. And I would say that that's a lesson learned and also a bright spot. So it's kind of like a twofer, if you will. So that's something that we would definitely lift up and bring to the forefront. And just really underscoring this idea that Dr. Rao talked about earlier in regards to, in our community, we tend to, if we get a referral, sometimes the referral might be based on the child. But Dr. Rao, you talked about how important it is for us to understand that that child comes with a context, comes with a family. And so we're looking holistically, thinking about the child. And even though the referral comes in for the child, we've also found that there are ACE scores and impact that's happening for the people who are responsible for caring, loving, and educating that child. So we've really stepped into this lens of how do we serve and support from a holistic standpoint, valuing the science of child and adolescent development and looking at the continuum of development through strategic partnerships. So that's what we would say one of our biggest lessons learned, and also a high mark for what was already going on in the community.
Great, thank you so much. A lot of rich information there around how we think about being strategic and leveraging the existing ecosystem that's really supporting our communities. Denise, Sharon, anything else you want to add to that around kind of lessons learned from your perspective?
No, I think Senta said it beautifully, and I just underlining, and I think that everybody's saying that, right, is leveraging those partnerships that you have. And a lot of it is just based on relationship. It's relationship building.
Great, thank you. I think the next question I like to share is, this was a 6-month planning grant, right? I think before we knew it, we were in month 4, month 5, right? And then, thankfully we got an extension to go in September. But can you speak to some of the growing pains or challenges that you've experienced as you've kind of, had boots on the ground or moving this work forward to really support the vision that you all are working towards as you think about ACEs and what that looks like in community?
I'll go ahead and jump in there. I think one of the biggest hurdles we had to cross in the very beginning of designing this network of care in Ventura County was the platform, like what IT platform, what were we going to use for resources, and we were very concerned about whether or not we'd be able to find one platform that could kind of do it all for us, track, provide the referrals for us, and then also just the closed loop referral, so that the information of once we refer, it comes back to the pediatrician or to the physician that actually sent us the referral. So that's been a big hurdle for us. However, we've been lucky enough to sign a contract with Unite Us, who from the gates has been so good at open communication and engaging with us and providing information sessions. So we haven't actually started using them in the pilot that we'll talk about later that we're using, that we're doing right now, but we're looking forward to just how that's going to work for us and how it's going to support all the work we're doing in Ventura County. So I think that was probably the biggest hurdle for us, is choosing a platform and figuring out how exactly that platform would work for us.
Others? Laura, Skylar?
I'll add another, I think, challenge that comes up with, even those last 2 months that were added. We're finding with a lot of the partners we're reaching out to, there's a lot of transitions happening in management right now. I don't know if anyone else has experienced that, but we have a local regional center that we're very excited to talk to, and we have talked with them. It's just the lead person that would eventually sign off on that has left, and the new person is transitioning next month. So we will be taking a new meeting with them to get buy-in, but we were kind of bummed that, it was happening in August and not in June. But the advice from our ACEs Aware liaison was just, when that meeting can happen, just full speed ahead. Just because this ends September 30th for us does not mean the work ends. There will be future opportunities, and you want to still keep that momentum going.
Yeah, I think one of the hurdles we had to that we struggled with was when we reached out to our partners, the upper management team was really engaged, and then they appointed staff to our network of care to come into and represent them. But we really need somebody in our network of care that can make decisions there and then. And we've had to wait a couple of weeks before we can get responses, because they have to go back to their management and get approval for doing things and making decisions for their agency. And I think that's one of the biggest hurdles, because it's taken us a while to get to the protocols and procedures established for our network of care to get the pilot going. So I think that was one of the biggest hurdles we had to struggle with.
I know there's a lot of discussion around, a lot of pilot work or a lot of emerging work that's happening as you have kind of moved into moving towards kind of implementation of all the planning that we've done over the last 7 months. So can folks speak to, discuss any kind of pilot work that has resulted from your planning efforts and kind of elements of what that looks like?
So I can speak on this. I'm happy to report that our network of care in East LA and all of our partners went live last Monday. And so we're really excited to get the work out there in the community for ACEs. I did see Annika and Eric on here, and so I want to give them kudos for helping us get to the point where we're at from Unite Us. That is a platform that we are also using, and they had been excellent in supporting us moving to the date that we wanted to go live. And so I think I don't have any details yet because it's only been a week that we've been live, but just the help that Eric has given us and Annika and the support, and I think just everybody in the community being excited to get the ACEs movement going in East LA is great. And so we're very excited for that.
And I can speak to what's happening in Ventura County a little bit more. And it's actually related a little bit. I see there was a question that Stacy had about how we expanded Help Me Grow beyond age 6, essentially, and what it looks like, which is related kind of to our pilot. But what we did was, as First Five Ventura County, we're an affiliate of the Help Me Grow model, which is a national model, which is only 0 to 6 essentially. But the partnership saw that this model works really well for communicating with families, identifying concerns, and then providing that linkage, which is really essentially what it's all about, is that linkage, the warm handoff, so that people are getting connected to the services that they need and the supports. It doesn't have to be a service per se. And so what we've done is just done a lot of training and used almost carbon copied what we're doing at First Five to the partnership, right? And saying, okay, well, this is how we work with families. Here are the conversations, how we have conversations with families, literally down to here's some of the data that we collect. So we're just trying to take that and seeing how that works when you're working with older children and adults as well. And so because we did that, and because we're only in a planning grant, we felt we wanted to do a pilot that would test out how does this work with older children and adults and families of older children. And so I think Skylar mentioned that they were also working with a round 1 grantee, and I've also been involved with a round 1 grantee. And so I was already plugged in to a pediatric clinic that is working on implementing ACE screenings and doing some of that follow-up and how to appropriately implement ACE screenings. And so we're working closely with a pediatrician in that clinic. It's an FQHC who's been doing ACE screening for some time. And we're running a 5-week pilot where we're testing out kind of which families, which patients are appropriate to send through navigation services. We're using our Help Me Grow because we have an existing call line, fax number, all of that good stuff as the triage point, as the centralized access point, and then sharing any families or patients that are over the age of 6 with the partnership. And we're essentially just testing out, what does it look like to use these pathways? What does it look like to tack on to this clinical protocol that they have set up in this clinic to then follow through with the family and provide that extra support to get them to where they need to go. And what we're finding with our pilot is that, of course, and I think people have said this on the call already, but yes, there are some families that say, I need, to get connected to behavioral health services, but a lot of it is just getting like someone to talk to. Or we had a family recently that really just said, my kiddo isn't doing anything. Can you help me figure out how to get connected to activities that he can do that won't cost me a lot of money? And I'm having trouble figuring out where to send him. And so that's been some of our highlights of finding out that we have to, as Senta said, look at the family holistically, and it doesn't mean that a one size fit all for all families. And we are finding that there is a great need in our county for care coordination and navigation, that just having lists of phone numbers isn't going to be enough, that we need to have this kind of support in order to move from those ACE screenings in the clinic settings with our doctors to then getting people connected to what they need in the community.
Great, thank you so much, Sharon. A lot of kind of rich information around how you are really thinking about designing the pilot to really leverage existing resources and expertise that you are connected to. Other thoughts from other folks, like other elements that, excuse me, that you've thought about as you think about the pilot?
Sure, I can add from the East Valley team. So we are fortunate to have an academic partner and use all the smart people at Claremont Graduate, all those PhDs and PhD candidate students. They've been organizing our pilot studies that we're going to be doing with the Unite Us platform. We're a few weeks behind Laura and her team at Hillsides. Right now we've registered our organizations who will be doing this platform. We've identified the staff who will be the ones trialing it out. We're not starting with a large group of staff, just a smaller group of staff. So we could work through, what works, what we think needs modifications. Of course, we'll be starting with the Pearls ACE screener, but we've also added in a social determinants screener as a supplement to catch, what's happening real time with these patients. And that screener was developed through one that was already created by Unite Us, but we added some of our own questions as well. So more to come on our pilots. We'll have more information probably in 3 weeks when we go live.
Skylar, you bring to mind, and I'm going to ask Denise or Sharon if you could speak to it, but our partnership with United Way, because we've had the opportunity to develop an internship going that route. But before I do that, I just wanted to take a few moments and speak to the configuration of our team being multi-generational, multi-ethnic, multilingual, and we would dare to say multi-talented in regards to being able to really have deep outreach into the community. Because there's quite a few incidences where there have been some concerns around equity issues and families having access. So we talk a lot about supporting our families, getting their full participation, but also creating access. So thinking about who's the configuration of the care navigation team. And then the other thing that we would add is really lifting up our parents as seeing them as parents, as leaders. And so the people that are on our team, we have the technical skills, we have the expertise, the knowledge, and we also have the deep life work experience of living life as a parent and having that redemptive story that I navigated the system myself and I could reach back, lift up, and give to other families. So that team configuration has been really powerful in thinking about how do we actually authentically do this work and have people that have lived the life be part of the experience and navigating what we're doing for families.
And just to add to what Senta was saying, one of the things we failed to mention is we have been lucky enough to create a partnership with United Way, and we're in the process of hiring somebody that will actually design a care navigation system for us using United Way volunteers through AmeriCorps. It'll be that will be a part of the navigation team going forward. If we're lucky enough for implementation, that's our plan, is to have to partner with United Way and use their interns as our care navigators.
Great. A lot of great kind of information. How do we kind of center equity? How do we think about this work, you know, to really support our communities who are the beneficiaries of the services that we're trying to coordinate and support? You know, I think one of the things that has come, you know, to mind for us, also Kern County, is thinking about sustainability and what does this work look like, or we want it to look like after the planning grant is over. You know, we haven't heard anything from if grants are going to continue or what the status is, right? So how are you all really thinking about sustainability and hoping what this work will look like after the implementation grant or planning grant comes to an end in September? I know that's a loaded question, so. But any initial thoughts or reactions?
Well, we just started having that conversation in our network of care. That was basically our conversation this week about how do we continue this great work, right, without having any funding moving forward, and what is it going to take financially for each agency to be able to carry the work into the community, continuing the good work. And I think one of the things is just committing to this network of care and providing that whole care client approach that we have created in with all the partners. And then hopefully down the line, there is new grants and new opportunities for all of us to be able to expand our work. But I think for now, I think it's going to be more of just a commitment to the work and the passion that we have for the community and for the clients, right? I think that's one of the key components here of how passionate you are of this work and how well we're going to continue to do it without having any funding.
Yeah, I'd like to add from our group. So I think one thing that comes up with our group is where our geographical region is, because we're not in LA proper. We're just a few miles from Upland, which is San Bernardino. So it makes us think, you know, we're doing the planning grant focusing on Pomona, but we're starting to learn just a few miles away, there's some great work being done. So we're thinking, you know, if this continues to be funded, you know, can we expand into the Inland Empire, because we are right there. A lot of the residents who live in Pomona might get services just across county lines. So that's something definitely on our minds, if that's something we are able to do by expanding into a different county.
One of the things that, oh, go ahead, Denise.
Oh, I was just going to echo a lot of what Laura said, that, you know, we're just committed to sustaining this good work that we've worked so hard to establish here in our county. And I mean, in an ideal world, we'd love to see this extend to every clinic that we have in Ventura County and set up, you know, the network of care throughout our county. Obviously, it's dependent upon implementation grants, but we will regardless work hard in sustaining the work that we've done so much to do, you know, to make it to what it is today. So.
Santa, do you want to share?
I was just, sure. We have in our design and development, every week we have a meeting with our core team. And we're able, and I see, Laura, you're nodding your head. So that's probably something that you're doing. And we've taken this model and have expanded it out into the community. So once a month we meet with the community, and we have become almost like a hub, if you will, where all the community partners, we've been working to decenter the silos and create a space that really welcomes courageous conversations and inclusive leadership, where everyone could share their voice, their resource, and opportunity, so that we can keep this work going. So that's something that we put in play as the result of the grant, but we're hoping that it has enough life and inspiration while it will continue, even if the grant does not return. Although we don't put that in the universe, we're all about let's claim the grant and go for the implementation, and hopefully that money will be there. But looking at how do we continue to leverage strategically, thoughtfully, methodically our partners, so that this is not just grant-based, but it's wisdom, it's inspiration. There's a deep commitment by the community to say we need to do this for our families and for adults and for children.
And I think it's best practice, right? I think what's going to be better for the clients is going to be what we're going to, as in a whole, implement. And I think that's one of the things that we need to look at, like what's best practice. And we have a lot of, you know, DMH gives us a lot of questionnaires and data that we need to collect. And I think this is another one that we just need to add to our repertoire of questionnaires that we give our clients, right, to provide them best services. The one thing that I do want to add is that we were also awarded the ACEs 1.0, so we were also involved in that. And through that, we were able to partner with Dr. Amy Stober, and she's out of Portland, Oregon. And as you know, Oregon has been doing ACEs for over 7-8 years. And so they pioneered ACEs. And so she has been able to come onto our network of care as a consultant and provide us a lot of the training for the ACEs champions and who's going to be doing the screening and how to approach those conversations with those clients. And so she's been pivotal in our network of care and our planning and how we're going to be able to sustain this work. And so I just want to give her kudos. I know she's not on here, but she's a great asset and a great resource. If you ever need somebody that has wealth knowledge of ACEs, you might want to reach out to her as well.
Great, thank you so much. Great resource, Laura. Thank you so much for sharing. I'm sure folks are jotting down that name and trying to figure out how they can connect with her. You know, so we're running up on time. Want to offer kind of final, if you can all share just kind of final reflections around this work, or you know what you are thinking and hoping for as we kind of move into the next iteration of moving from planning to implementation and sustainability. So any final remarks or thoughts so that we close out the session?
I want to say, you know, the planning grant definitely motivated conversations that we hadn't thought about before. And anytime we meet with a partner, we ask them, you know, who can we connect you with? Who should be part of this conversation? With East Valley, we were talking to their team and they said, you know, we really want to connect with the regional center. Could you help us with that? And so we've just been repeating that conversation. And that's kind of how we grow our network of just, you know, who do you wish you had the opportunity to work with, but hadn't had the either staff or capacity? That's why they use me and my team. One thing I really appreciate about our community development task force is the two co-leads. They're Pomona residents. They've grown up there. They've done community work there. There's students there. So they've already are really well invested in the community. So when they reach out to partners, it's really already that trust-based relationship is there. And I like how Senta echoed that you've got different facets of the team, representing different expertise and specialties. So we're excited to see what's next. I'm excited to get, key folks on the Unite Us platform, see how we can close those referral gaps. And, a great thing about that platform is, it's so patients don't have to repeat their stories. It's all really in there. You don't have to have that re-traumatization. So yeah, more to come from the Pattern Network.
Laura, Denise, anything?
I think one of the things that we're really looking forward to sustain this work is we were able to partner with UCLA to get interns to help us really gather and recruit new partners into this network of care. We want to grow it as much as possible to be able to provide all those services to the community. And I think that's where also Unitas comes in with their data. They'll help us figure out the gaps of the needs that we have with the Prepare tool. And so I think that's one of the great ways. And I saw the question on the chat of how does Medi-Cal reimbursement for screening feed into sustainability? Unfortunately, the only people that are able to take advantage of this is medical facilities. Mental health facilities, behavioral health facilities aren't able to bill and tap into that resource. So that's something that we're talking to the grant Aurora providers to see if there's any change that can be done, because that would be very helpful for all of us, right? All the CVOs in the community, that to be able to tap into that resource. And so hopefully by this planning network of care and all the lead entities, our message is loud and clear, and that is change. And so all of us are going to be able to one day or another be able to tap into those resources.
Perfect. And then Denise or anyone from your team, I'll give you the last word because we're running up on time. But any final thoughts?
I was looking for Denise and Sharon. I was going to pause for a moment before I say anything, but the energy is amazing. Laura and Skylar, it's really awesome, for lack of better words right now, to be in space with you and thinking about what we're doing, how we're doing it. And it gives so much energy because we're one part of the state, you're in another part of the state, but knowing that we're all connected, everyone in this community doing this deep work. And so that's super energizing. The other thing I want to say is that our policy consultant that we meet with every month, Rita, has been amazing, and making sure that we're staying current on any of the webinars and information that's coming out through ACEs Aware. So I'm not being funny, I'm just straight up doing a plug because the information has been rich and incredibly useful. So if you haven't had a chance to log into those resources, those are really great resources. The other thing is, we got to figure out these waiting lists. I don't have an answer in this moment, but I hope that all of us together can really think through. Denise and Sharon can speak to this with greater depth and insight, but the idea that we talk about food insecurity, I think it was either Stacy or Kendra that was talking about food insecurity. We also to actually pair with the food insecurity, housing insecurity. In our county, we went to go help a family to try to locate Section 8 housing, and there's a 10-year waiting list. I mean, that blew our minds, 10 years. And so it's like, we have to do better, and just trying to figure out how we can be a response to a deep need like that. So the waiting list, and I'm looking at Skylar and Laura because you're right in my view. And when you nodded your head, that signaled to me that it's not just a Ventura County issue. It's probably a statewide, nationwide issue. But I would love for us to figure out collectively as an ACEs Aware community, is there something that we could do about that? What it is, I don't know. But I know collectively we could figure that out. 10 years is too long. So other than that, that's all I would like to share. It's been an honor.
Thank you so much. As you put it, thank you all for being in community with us. I know we could spend probably hours kind of talking through and digging through a lot of the planning work that we've been doing over the last 9 months, but really it is an opportunity for us to think about how we move together, right? As a community, as a network, not within just our respective counties, but across California and beyond that. And so this afternoon, we'll have time to enter into dialogue with each other and kind of think through some of what we're hearing around the pilots, dig deep into it, and think about how can we generate some ideas, discussions that we can elevate for advocacy, elevate within our own counties to draw down additional dollars to support this work. So excited to enter into conversation with you all. So with that, I appreciate every single one of you. Thank you for being in community. What we'll do, I know we've been kind of sitting and talking at folks, so we'll take a 5-minute break before we come back to the Unite Us and Kern Connected Community Network presentation. So thank you.
Having me.
So 5 minutes, folks. We'll be back at 11 a.m. Oh, sorry, folks. So folks can't hear me. So thank you, Kristen, for sharing some information. So we'll have Kristen Bell Watson share a little bit of the Kern Connected Community Network, and then we'll have Unite Us, Eric Hazard, and Kendra from their team joining us in conversation in the Q&A. So Kristen, take it away.
Awesome. Thank you, Hector, very much for the opportunity to share about the Connected Community Network. For those of you who are already registered partners and using the network, thank you for your patience. We just, want to use this opportunity to get word out and have people better understand what the network is and how it's moving forward. So the network's been in place since early 2020. Actually, it launched in December of 2019, but really effectively started connecting folks in early 2020. Next slide, Hector. The overarching goal of the Connected Community Network is to really create that community solution that's going to address those social determinants of health and link individuals to the community services. So really focusing on that holistic approach and identifying where those unmet needs are. More specifically, on the next slide, we see that the vision of the network is to connect residents to the right services more quickly and more efficiently, allowing them kind of a one entry point so that they can get connected to services and not have to be telling their story over and over again and re-traumatized, right? The second thing that we hope will come from the network is that our service providers, whether they're nonprofit organizations or public agencies, but that we can, in fact, coordinate and collaborate to support client services and work more efficiently. And then the third outcome is the data. The data that we are gaining from the network really helps us to not just demonstrate the impact that we're having on the community, but really to show us how we can all move forward and work together to improve access, to close those gaps in services, and to really improve health outcomes overall for the community. So the network actually is lifted up by these folks on the screen. We have some really amazing funding partners in Dignity Health, Kaiser Permanente, Kern Health Systems or Kern Family Healthcare, HealthNet, and Blue Shield. Unite Us is the platform that was selected to support the Connected Community Network, and the Community Foundation was asked to come on and serve as that community convener. We have a staff person who's actually on today's symposium, Christina Camacho, and I would say she is the community champion for the network and is just doing some amazing work. Next slide, you can see that in the 18 months of pandemic work, we've still been able to connect and bring on 72 active partners. For those of you who are familiar with the network type situations, these partners typically will represent more than one program. So it's not just 72 programs, it's multitudes of programs, but represented by 72 partners, and we're continuing to add more every week. Next slide. One of the things that we think is really important is that this network is a community network. And so we work really hard to develop those deep roots with our partners. And as a result of that, we have what's called the Community Advisory Group. That group is currently come one, come all. Partners, please come to the CAG. And it really is an opportunity to think about how we build this healthy network. It's so that the network can grow organically and have, again, those deep roots. So the network is looking at what is our coverage. The CAG looks at what is our coverage? How can we better engage the partners who have registered? What does the referral quality and efficiency look like? And then ultimately, what's that adequacy? What kind of an impact are we making? So the CAG meets quarterly. Again, next slide, if you look, we have a visual on really, and this was helped with our partner Unite Us, saying, here's what really look to be signs of a healthy network. And so that's where we're at. We're really focusing on this network coverage, partner engagement, the referral quality, and then we'll move into this network adequacy and impact. I think I'm going to turn it over to Eric because he's going to tell you a little bit more about Unite Us.
Thanks, Kristen. Good morning, everybody. Eric Hazard here, Director of Network Development. I'm really excited. I'm here with some other folks on the call as well, as well as my great and awesome colleague, Kendra, and really excited to share a little bit about Unite Us. I'm going to let Kendra go and do some of these slides, and then we're going to have some additional conversation with Kristen. As really at Unite Us, we're really focused on connecting clinical and social care. A little bit about my background relevant to the ACEs work, and I know I'm so excited to have some of our other planning grantees that have partnered with us on this call. So fantastic. It's really based on thinking about the individual, right? At the end of the day, folks in our communities, they need care. They don't look at care from just a clinical lens or even a social care lens. They just look at it as an individual, right? And so we think about doing work in trauma-informed ways. And I'm on the board of directors of Leah's Pantry, which is a trauma-informed food nutrition organization, does great work here in California and actually across the nation. And what I really love about working here at Unite Us is we're thinking about how do we use technology well. And honestly, I've been in other organizations, other companies, and they're just trying to get people to download an app. But at Unite Us, we're here to say, how can we partner? We know that there's already so much going on in the communities. We know that everybody's doing their best. But how do we elevate and connect people together so they can do this work in a more meaningful way? And as Kristen pointed out, we're really there to help people just tell their story once. And as we think about this work around trauma-informed networks of care and ACEs, how do we look at helping everybody get connected, and how do we get people to the right types of resources? As I've talked about with all the other grantees we've been working with, you know, I really appreciate what Dr. Nadine Burke-Harris is doing at the state, really thinking about the clinical folks. But at Unite Us, we're thinking really, how do we engage the social care organizations? How do we work with them to enhance their ability and really think about how to make sure that they're trauma-informed, and how do we connect people on the platform to ensure that they're able to connect to trauma-informed services, organizations with staff that have been trained and equipped. And Unite Us is not trying to be the arbiter of that, but we are saying, how do we do that efficiently? How do we take the same platform that can get people connected efficiently to social care, but make sure they're getting efficiently connected to toxic stress mitigating services or other care from organizations that can actually provide services in a trauma-informed practice in a trauma-informed way. So I'm really excited to be a part of this. I'm really glad there's so many different organizations on this call. And we think about this work, we really think about it from the Unite California perspective. We're not just making a network in Kern, right? We're saying, how do we connect everybody? Apparently there's 3,006 counties in the United States, and at Unite Us, we're trying to connect all of them. We're trying to build networks across all 3,006. And it's a really exciting time. And I think where things are moving with California, with CalAIM and some of the other services coming down with the lieu of services, et cetera, how do we think about connecting people to services in an efficient manner, and doing that where we elevate the roles of community-based organizations? They're so important and imperative to providing care, real care, not just clinical care, but the care that's there to support people from the social determinants of health lens. That's really what we're focused on. And I'm so glad we have such great partners like Kern, First Five Kern, and Kristen Bill Watson at Kern Community Network. It's really fantastic. So I'm going to kick it over to Kendra to go through a couple more slides about what we've been doing within Kern around some of that data that Kristen had referenced.
Awesome. Thank you so much, Eric. My name is Kendra Devedjian. I'm a Senior Community Engagement Manager here with the Unite Us team. I'm in Fresno, California. And kind of similar to Eric, before joining the Unite Us team, I come from the early childhood and family development background. So I was with First Five for about 15 years and was one of the original architects of our system in Fresno that's now become Help Me Grow, as well as our Cradle to Career, which is now overseeing our ACEs. So really was excited to get to learn about the Unite Us platform. It was kind of the one missing piece, I think, that we were always searching for in order to reach that goal of truly coordinated care. So now I have the distinct kind of honor to get to support, alongside with Eric and some of our other colleagues, the ACEs work that's happening across our state. So kick it over to the next slide. I got to start here in Kern. We launched in Kern here in California in 2019. And so now, as you'll see those dark blue areas, as Eric was mentioning, we are now a statewide network. So one of the things that I love about our platform is I see if there's something that can help support the human condition, there is a good chance you're going to find a service or support for it. So we are working with key institutional partners, kind of those key anchors, if you will, across communities here in Kern, whether it be Agency on Aging. We have really been developing strong workforce partnerships across our state, because as we think about those same barriers to good healthcare outcomes, often are the same barriers we're seeing to good employment outcomes, right? So whether that's trauma that's been experienced, whether that's childcare, housing, food, all of those things like also play into those. So working with them as well as our behavioral health partners, knowing that we're a local control state. A lot of you, right, our behavioral health departments, our public health service, our mental health service act dollars, all of those also are key pieces to how all of these supports kind of weave and connect together. We're really excited that we've been making great progress with county councils across the state as we've been engaging with public health, behavioral health. It's a big hurdle, right? Making sure that we're meeting security, that we're able to facilitate the types of referrals of care around behavioral health, interpersonal violence, and all of those others. So we have been able to now successfully bring on several county departments across the state, including here in Kern County. A lot of that as well at the leadership of our first 5 partners who have really been helping to guide us. And then you'll see here our priorities around home visiting and early developmental services. As I mentioned just briefly, Help Me Grow. We are supporting several Help Me Grows, but right, this all ties in together. When we think about trauma, when we think about the things that families are experiencing, often sometimes these warning signs show up, as I know Dr. Rao sees every day, right, is developmental concerns in the children. And so as we're digging down and we see that there's actually broader issues and things that the family needs, it gives us that ability to link in. So we are having good conversations and looking to support initiatives here in Kern as well as others around home visiting and Help Me Grow. And then looking into how all of these things kind of tie together under that broader umbrella of CalAIM. Eric, I want to toss you just for a second, because I think that's a really important piece. And I know you've been leading those conversations. If you could just kind of hit on how we're supporting both here in Kern, but across the state, some of those CalAIM conversations that really tie into, most importantly, right, the billing for which we can get for not only those screenings, but the services that are being provided as a support.
Yeah, absolutely. And I'm sure a lot of you are aware that, Department of Healthcare Services is really thinking about how do they shift some of these dollars into social care. So they've created these 14 in lieu of services. So really looking at community-based organizations, social care providers to start providing care and actually get paid for it and get contracted and get invoiced. That's exciting on one hand, but it's really important components on the other. So here at Unitas, we're very much focused on ensuring that CBOs get paid, and we start to think about real healthcare transformation. On the one hand, we really want to make sure that everybody's able to access their dollars and get paid, but on the other hand, not turn every CBO into a medical provider with a really intense billing system. So we think about how ACEs and some of this work, as we really work together, I think it's really important to recognize we're able to, I think, drive the conversation to say, not only is ACEs really important, as we all know, but it really plays into these other areas and start to make sure that long-term sustainable funding is going to come down from the state to provide, really the dollars and cents to really allow our partners and organizations on the call to engage and really ensure that they have long-term sustainability. So yeah, Kendra, it's a great point. I know a lot of folks right now are just focused on figuring out, are they going to contract and how does that work? But Unitas is there to support that in that same vein as well.
Well, no, but Eric, to your point, right, in the conversations that I've been sitting around, the question of sustainability is already coming up, right? A lot of these are grant funded, all of you, right? And we are always asked that question of how are you going to sustain this across that term? So just to note, we can be a partner in there. Stacy, you had a great lead-in question about what are the gaps and things that we're seeing, right, in services. One of the awesome things about this platform is that we are gathering that data, right? Not just for your community, but statewide. So here you'll see in Kern County, for example, individual and family support. I want to note this is really driven by the awesome work that Kristen Billetts and her team, Christina, are doing there at the foundation. When a CBO is struggling with capacity, or perhaps somebody doesn't have a connection yet, they're able to submit an assistance request form. It comes into them to provide that one-on-one support and those linkages, which we know are really critical to families being able and patients to be able to access the system of care. So you'll see kind of things that you would commonly expect, right? Food assistance, education, social enrichment. We're seeing that more and more as folks are coming out of COVID. People are missing connection and they want to get looped back in. So the platform does facilitate the ability to give those referrals for even things like volunteer opportunities or peer-to-peer family connections, et cetera. So you'll see, for example, this month we had 62 in-network partners here in Kern. That is continuing to grow, 118 programs receiving referrals. And again, I think this has been a huge community effort and really speaks to the value of this community network here in Kern. Next slide. You'll see the needs overview. So in the top network needs, again, 46.2%. I mean, that is saying families really need that connectivity and that somebody to help them navigate. That is really the kind of system that we're building here, is shifting that referral paradigm. So we're not just giving phone numbers. We're not just providing a portal where somebody can search for a resource that may or may not be appropriate for them. This is about providing those connections to care so that our partners are able to make those one-on-one connections. So you'll see those numbers there. Obviously, housing and shelter, I think it was noted earlier about those waiting lists. I love the idea of, right, how do we use this data to actually drive community conversations around advocacy, around gaps, the fact that we have those wait lists for families. You know, those are big things that now we have real-time data that isn't just 2-3 years old, right, that we got in a survey a couple of years back. This is showing us in real time, you know, where we are seeing connections, but also where we have big gaps and barriers to care. And then last one, Eric. Okay, so I can honestly say I came into this network again in Kern County. I started in July, so it's been a year. And to see the amazing growth that has happened here, it would not have been possible without the leadership of the Community Foundation with Kristen and her team. And so I have just a couple questions we want to throw out to have her be able to respond to kind of how the journey has been there. So Kristen, I'll let you take that first one there. For those of you who may not be on screen, I'll read it so that you can hear that. It says, the Network Health Data Dashboard is intended to provide a picture of the social determinants of health across Kern. Individual and family support continues to be the highest need. Does this data that you're seeing reflect your understanding of the county's needs, given where you sit, both in your current and now awesome new position that you're going to be going into as well? Any surprises that you're seeing?
No, Kendra, these aren't surprising figures. I think when you look at other metrics for the county, whether it's the rate of poverty that we experience here in Kern, or data that's come from the recently released market assessment that deals with inclusive economic development. 52% of the residents here in Kern County are struggling to sustain themselves, to live without any kind of a social service network. And unfortunately, 2/3 of that 52% are people that have jobs. So we really have a gap that needs to close with regards to how we can lift all residents up here in Kern County. So to see the data, I'm not surprised. I think the data, though, is one more point, one more pinpoint that we can speak to as a community to say, look, no, I know I'm preaching to the choir with the folks on the call today. You guys see this day in and day out. But we, I think, can, with the information that the network is providing, lift the data up and say, actually, we have evidence that this is a problem. And so excited to see where we can go from there.
Okay, so our second question, how does the focus on families with young children, really those that are trauma-informed services, help support the overall network? You know, thinking that we know we have things from, you know, prenatal services all the way through hospice and in between. What is your sense on how these can help support build us overall?
Well, I think focusing on families with young children is foundational. It allows us to really build trusted relationships. It allows us to really think about not just being reactive, but actually being proactive to the services that can be offered, and which hopefully we'll see more efficiency as we think about the services and the continuum of care. If we can get in earlier and diagnose issues and try to provide those missing services, then the hope is long-term we won't see the larger or increasing needs. So I see the work that we're doing and so happy to be at the table with First Five with the ACEs work as being pivotal to really transforming the community.
Great. And on this next one, so as you know, we've grown together, I think a lot, Kristen, this last year. You've helped hold us accountable. You've helped us grow and be better. And, recognizing that as we've shared throughout this rate, overall, this is a slightly different way of doing care for a lot of folks. When we think about how these technology platforms are kind of shifting those connections. And so for us, where would you like to see in terms of unite us and our focus and efforts in terms of helping to better support this work in Kern County over the next 6 months? What are some areas that we need to learn and grow, and where would you like to see us really kind of lean in this next period?
Good question, Kendra. I think, the overarching goal is that we want to see the network continue to grow and to flourish. And so when we think about the growth, I think we want to make sure that we are connecting with the right partners. So we're not just adding partners for the sake of adding partners, but we're really diving in and saying, okay, what are those strategic partners that perhaps aren't on the network, and really identifying ways to engage with them and bring them on. It means reaching out to our existing partners and saying, who else needs to be at the table? And really asking those questions so that, again, we're doing this very targeted growth. And then the other half of it is, as we bring new partners on, we all know that staffing many times with our nonprofit partners continues to be a little bit of a revolving door. And so we need to make sure that as those transitions are happening, we're bringing the new folks along and introducing them to the network, giving them the training. So I think the next 6 months, we're going to be focused on engaging those really influential and critical partners, but also keeping that training level high to make sure that our existing partners are continuing to use the network in the way that it was intended.
Well, that's great feedback. And I hope, and you will continue to hold us accountable to make sure we're meeting those needs. And so last question, Kristen, again, I just want to personally thank you for everything you've done. Every time you've been willing to just show up, you never say no, despite your busy schedule. So thank you for being such a huge champion. So as you're transitioning to your new role, when we think about the things that maybe are barriers at times for students, as many know, right, we are HIPAA and FERPA compliant. So, given the fact that we can facilitate all of these things across those populations, what do you see the role in us, just not as a platform, but as an ACEs community, being able to really support your students at Cal State Bakersfield?
Absolutely. So for those of you who don't know, I've been at the foundation for 6 years, a little more than 6 years. And I've been given this incredible opportunity to transition now next week to serve as the Chief of Staff to the President at Cal State Bakersfield. And so it's an opportunity that allows me to pursue a tremendous passion of mine, and that is improving educational outcomes and actually community outcomes as a whole. And so in regards to supporting students, I'd say that the Unite Us platform could be a really valuable tool. It's not just about the coursework that we offer at the university. It's really about how can we support the whole student? How can we remove whatever barriers might come in their way? We know that a majority of our students are the first in their families to attend college. And so they come with some unique experiences or lack of experiences, and we need to help them navigate the waters to make sure that they're not just attending classes, but they're actually growing and thriving and really getting the most out of their post-secondary experience. And so that's from the student perspective. But I also think from a faculty perspective, we have an opportunity to really think more broadly about the curriculum and the coursework that we're offering. Is it, in fact, coursework that supports trauma-informed care? Does it support that new generation of social workers as they're heading into or even into public service? Does it support them in the way that best supports the people that they're working with, right? So I think there's a lot of work to do. I'm really excited to roll up my sleeves and get that done. Well, attempt to move that conversation forward. And I will say, I feel really, really confident about having Christina at the lead of the network here at the foundation. She's done amazing work. For those of you who haven't met Christina, please reach out to her. Her contact information is right here. She's also on today's call. Even if you just have a little question, like, I don't know much about this network, Christina's the one to talk to. She can share with you what's going on. She can tell you firsthand experience, because if you were to go to our website, kernfoundation.org, you could see up in the upper right-hand corner, we have a Get Help button. That links people directly to the platform. They submit a request, Christina reaches out to them and works to support whatever their needs are. So Christina can provide experiences, not just as a community organizer, but actually in the trenches working on the network on a daily basis. So I would encourage you to reach out. And can't say enough about our partners at Unite Us. They've done just phenomenal work. It's been so exciting to see the growth. Kern was one of the first counties in California to hop on, and it's been great to see just how well received it's been in California. And again, also hats off to all the folks at First Five for really having the vision to see that this network could truly come alongside and support the work with Resilient Kern and the ACEs program. So thanks, guys. Happy to answer any questions.
Great. Thank you so much, Kristen, Eric, and Kendra. A lot of rich information was shared. Let's take one question. If there's a question from anyone that they want to throw out, either to Unite Us or anyone on this panel. Anyone have any questions? I don't see any raised hands.
We did have one in the chat, Hector, about joining. So if you see my information here as well as Eric's, and you're hearing Kern, you can also reach out to Christina. But anybody else on the call that's in any other part of our state, feel free to reach out to myself or Eric. We can definitely get you connected. It's a very easy process. For most partners, it's free or low cost. So just reach out and let us know, and we're happy to make those connections.
Great. Thank you so much, Kendra. I know a lot of information has been kind of shared out today, right? We had, work around the pilot that we've shared. We've had other ACEs planning grantees share their experience around moving this work forward around ACEs and what that looks like in their communities. And now you've all heard a little bit about what the Kern Community Foundation has been doing with Unite Us and the Kern Connected Community Network to really develop the ecosystem of partners that are really supporting community here. And so what we want to do right now for the next 20 minutes is give folks some time to kind of digest and in small conversations, really think about, what did you hear today? Are there questions that are coming up for you? Are there ideas that are being generated that we can kind of move on and actionize as an ACEs network, as partners here in Kern County? And so what we'll do for the next 20 minutes is go through these kind of 3 questions. I'll break folks up into small groups so you can join the kind of breakout sessions. But really it is, what questions are emerging as you're hearing our partners on the call today talk about ACEs, their work, the technology platforms like Unite Us to really support solutions that are supporting our communities. What do we do with the ACEs score and how do we use it moving forward once we integrate it into the Unite Us platform, into our kind of clinical workflows? And then are there any ideas that can really help further the ACEs work as we kind of come together and really think about the work that's evolving over our communities? So with that, we put Paula, my colleague, put it in the chat to a URL that can take you to a kind of Google Doc deck where you can kind of dump some of the information as I break you up into groups. It's an opportunity for us to come together, think about what this work looks like. And if you have any questions, feel free to message me in the chat, but we'll spend about 20 minutes kind of talking through this, and then we'll come back and kind of discuss as a larger group. So we'll break folks up into smaller groups. Okay. And folks can kind of join the conversation and go into your groups.
Open this up. Oh,
there you go. Rooms are now open.
Room 6. Oh, you're on 6?
Welcome back, folks. Can folks hear me? Thank you. So, I gave folks a little bit of extra time to kind of dialogue and be in conversation and space with one another. I think one of the hopes and goals of today's conversation was to learn, to create space, and really share information amongst each other as we think about what this work could look like as we kind of move forward and think about the sustainability, growth, and ecosystem development that can happen between our communities, both in our respective geographies, but across partners, across networks that span and support communities. We know that communities are mobile, they, especially here in the Central Valley as folks move up and down the coast. And I think as we're thinking about the future and building out a platform or a network that can tap across those communities, I think today's learning really gets at that, right? To the United platform, to the work that we're trying to develop as partners together in this work. And so for a few minutes, wanted to kind of give space for folks to kind of share out some of the things that you heard in your respective group. So I know some folks have tapered off, but wanted to create that space. So if you can raise your hand and then I can call on you to go forth. Anyone? You can unmute yourself and.
Hi, Hector, it's Diana. I could go first.
Go for it, Diana.
Okay, so with our group, there wasn't any specific questions, but there was a lot of good feedback with Dr. Rao's presentation and with her feedback and the challenges, and looking forward with their own agencies to see what their how they could fit into the ACEs process. We had one of our programs showing some interest in possibly signing on to Unitas. So that's always good knowing that, with these presentations, other agencies are aware as to what their role can be with this movement. There was some input from, I believe it's Kern Behavioral Health, when on the receiving end, as far as the agency, when they're working with families, that sometimes they're not aware of having completed an ACEs screening. So they're going through the process and say, well, I came for this referral or following my doctor's orders, but I wasn't even aware that I completed an ACEs. If maybe aren't informed or educated as to what the next steps are in the process of their referral. So we discussed possibly having some improved training for staff, making sure that clients are aware of what they're completing up front, instead of by the time that they're at that referral agency and going through the referral process. We also discussed the identifying community gaps and resources, what we've been talking about, and then also making sure that what the follow-up process would be once the family has completed the referral and what that looks like. And then we discussed how often the ACEs screening is completed, and Kendra shared with us that in every community is different. Kern seems to be ahead of the game, but then maybe thinking in the future as to how can we measure the Kern overall wellness once clients have completed the ACEs screening down the road. How can we measure is improvement, and then also gaps in how we can assist our families.
Great, thank you so much. A lot of rich information, especially around how do we kind of make sure we're getting the ACEs aware information out there, connecting that to our partners, but also to the communities that we're serving every single day. Anyone else? You can raise your hand or you can just unmute yourself and speak. Antonio, do you want to share? You're muted.
Excuses while we do musical chairs. So we'll wait a second for the video to come up real quick. A lot of what we talked about kind of addressed sustainability as well as increasing awareness of ACEs in our breakout group, specifically towards sustainability, finding ways to incorporate different avenues to allow the program it'd be great if we can implement the program, but if it won't be sustained through over the years, it's not the best program. With this, we came up with finding a way to get funding within Kern County. It was wonderful to hear many of the panelists discuss the different grants that they received, as well as the additional support that they have within their community. And Dr. Rao and I kind of looked at each other and realized that we really hope we could have some type of funding to continue and spread the message within Kern County. It's been great to have all the Kern County community members in this chat, but to find a way to continue funding it, I think could go a long way with spreading the message here. Additionally, towards what was the other thing that I mentioned? Tech savvy, thank you very much. Was the community presence on social media. As I believe Susan and Teresa mentioned, who I think they may have left the chat already, having a program or social media presence to help spread the message would go a long way, especially with some of the younger populations, which based on their age are people that we can help early on with their ACEs score compared to some of the older populations. Through our discussion, we identified that most of us have not seen a significant presence on social media, and I think that that could be one way we could kind of promote the message a little bit more, is by establishing one either within Kern County or within the area in general, depending on who can run that. And those were our main topics that we discussed and reflected upon, as well as our love for Unite Us. Unite has been wonderful with implementation, very receptive to feedback. The pleasure of working with them.
Great, thank you so much for sharing. Mark, I see your hands up. You want to share? You're muted.
Thank you, Hector. We had a lively discussion. Not sure that we stayed on the same 3 questions because we move fluidly, I will say, from one topic to another. But in terms of what questions do we have and how do we use the ACE score, we had a little bit of a discussion about the difference between a de-identified and an identified score. And it was shared that in some regards, it's better to ask if the patient or client has a score of 4 or more, rather than to get into the specific score. And that seemed to have a lot of legs under it, because what it did was it raised the question of why 4 or more is, what the difference is, first of all. And then secondly, it leads to a good conversation and an opportunity to explore how to address any needs that might percolate from that. So that was a great way to look at it. But there was agreement that gaining trust before getting a score is critical. Secondly, the question came up about, since we were talking about the Unite Us platform, can the platform and belonging to the Kern Connected Community Network be something that is a strong case management tool? And we know it can be to a certain extent, but it requires resources. And in particular, for family resource centers, for example, some of which are court mandated, so they have to ask a lot of questions related to ACEs, but others like differential response and shelter programs and homeless programs also can benefit, but they need the benefit of having mental health support services to follow through, because a lot of times those questions will lead to more needs. A third question was brought up regarding how can we promote ACEs as we go forward, is can we put iPads to use, screening for ACEs or screening for social determinants of health? And that's actually something that Unite Us is working with Ventura County, is sorting that out. That might save time and integrate more easily with an EHR as well. So something to consider, something to keep a listing for. And then finally, some other thoughts were, how do we engage faith leaders to address the stigma and associated with trauma And how can we have faith leaders help mitigate toxic stress, especially in light of the high number of overdose deaths that we've seen and suicides that we've seen during 2020? And then lastly, can we agree on a common SDOH screening tool? So those were the things that our great group talked about. Thank you.
Great, thank you so much, Mark. Definitely some kind of nuggets there around, how can we share knowledge with each other, especially around the SDOH, and get some consistency to support community, and then thinking about engaging partners that are not yet at the table. Stacy, let me bring you into the conversation. I see your hands up. So reflections, questions?
Yeah, I wasn't sure if someone else from my group wanted to be the one to share out or not. So I'm just going to go ahead and share. We primarily kind of focused on Unite Us in our conversation. Just kind of people wanting to know if it's user friendly, wanting to know, have you experienced resistance from the community and uptaking the Unite Us platform? We definitely have in our community in Kings County, and just discussing like how to address that, and discussing whether or not it's an appropriate platform for community-based organizations and why they should be on there. So we were able to kind of answer each other's questions within that discussion. And then we looking at what we're doing with ACE scores, determining needs and care planning was a primary element as to how those scores are being used, and expanding partnerships, understanding who are key players in the community that can support mitigating toxic stress, and using that community data to get additional grants, to get more funding, to show that there is a need, and to really continue that sustainability, because that sounds like that's a common theme in some other groups conversations, is that concern for sustainability. And then we kind of brushed a little bit on, one of our team members in our group talked about moving forward, creating an ACEs task force with care navigators may be an appropriate path to take. And also getting schools and early intervention sectors on board with this work, and identifying the gaps. And we kind of talked about how there is this gap for the kind of school age, adolescent age group and that's kind of a common issue across our communities. So just talking about that, that's kind of what we came up with. I also, just listening to you, Mark, talking about just identifying the 4 or more. I was in a resiliency conference where Dr. Anda was one of the speakers, and he's one of the primary physicians who initially did the ACE study. And he expressed concerns about using the ACE screener as a determinant of risk. And so I listening to him say that and thinking about, everyone's experience is different. Everyone's perception of their experiences is different. And so while someone might have an ACE score of 1, that one ACE experience could have been way more impactful to them than someone with 4. So that's where I would get a little concerned about, you might be losing people who really need that support who have less than 4. So I don't know if that approach would actually cover everyone who has that high need. And I think that's why there's other elements to the risk factor process of determining not just their ACE score, but other factors that might cause toxic stress in their life, determining what's the level of toxic stress, not just how many ACEs they have, but what level of toxic stress are they experiencing? Because that's really what you're targeting when you're providing services. So that was just a thought I had when you mentioned that.
Great point. Yes.
Yeah, thank you so much, Stacey. I definitely think, there's a lot of information that we can gauge, not just from the ACE score, but I think thinking about the whole person, whole care, and how we kind of connect them to the services and their story. And so I know, kind of next part of the agenda is really around partner reflection. So wanted to give a last opportunity for our speakers, Dr. Rao, Unite Us, Kern Foundation, Hillside, Ventura County, and other folks that kind of gave their time today to give their final reflections around, what do you all kind of got from the day today as we kind of think about this journey together as we're building out networks, building out systems of care that are really trauma informed and really supporting community and well-being. So I'll leave it up. You don't have to speak, but if folks want to share kind of final thoughts before we kind of move in close towards the end of the meeting. You can raise your hand to get in the queue. I see Dr. Rao is moving, so I think that, I'll call on her first.
Well, thank you, Hector, for your invitation and the opportunity to connect further with community agencies. In many ways, it's the community agencies that are our support system in terms of boosting us up and our work and giving us a pep talk here and there to go on. So the solutions have to be community-based. It cannot be medical, social, behavioral in their own little bubbles. The solutions have to be connecting the dots, and thinking in terms of silos is not going to help solve this issue.
Thank you, Dr. Rao. Anyone else from our panelists?
Yes, I just wanted to thank you, Hector and Dr. Rao and the other panelists for just trusting us as well to be your partner in this work. I want to put out, we had some conversations in our group, and Stacy mentioned, right, there are a lot of questions for the folks have about the platform, how it works, what it can do, what it can't do, all of those things. So, please, we don't have an ego in this. Like, we want to get it right as well, and that we are learning and growing with you in this new space. I always remind people, coming from First Five, I was very used to tough public comments and feedback, and I always say it only just made us better for community. And so, if you're concerned, you want to talk through things, you're not sure about it, please hit us up. Happy to do one-on-ones and just talk through and answer any questions or concerns. I always say some of our partners jump in right away. We had some awesome partners, for example, in Kings that joined right off the gate, and others that were on like meeting 5 or 6 or 7 or 8, and that's okay. So please just hit us up. Again, we want to learn alongside you. We want to learn and be a better partner and just transform the platform to the point we can in better ways to support your work. So please just let us know how we can best continue to be a good partner in the space.
Thank you, Kendra, and thank you for your leadership and really helping support, getting off the network here off in Kern County. So I appreciate that. Antonio, I see your hands up. You want to share?
I did. Thank you very much. I just wanted to take the time to thank everybody for this wonderful symposium. I found it very informative as well as educational, especially with the feedback based off of what I implemented and taking into consideration the suggestions that you guys had into future efforts that I will hopefully be making as I continue my medical journey. I also found that hearing the different aspects from CPS as well as the community network has been wonderful, and I'm looking forward to being able to continue to spread the message as I either move out of Kern County temporarily before I come back, and also be able to learn at what other communities are doing, and hopefully come back to Kern County and share what I learned from other areas and use it as a collaborative effort to continue building this network and hopefully helping as many people as we can with the message.
Thank you so much, Antonio. Anyone else?
Hector, I want to give a shout out to Aubrielle, who's been with us all morning. She's a high school student and very interested in this work, and we hope she will continue and share messages with her friends and colleagues as she goes forward. Thank you, Aubrielle.
Thank you so much for being with us today. So hearing no other additional partners wanting to go, one of the things that we wanted to share with you all, this was a great kind of half day to really think about how this ACEs work is moving. So through our ACEs planning grant, we built into it a conference where we can actually bring folks together. So on September 15, if, given public health guidance and if we're able to meet in person, we're hosting an in-person event, a full day event with plenary speakers, different workshops that address the issues around ACEs and toxic stress, and really thinking about how can this be a launching point to create synergy, energy with partners here in Kern County, with partners across our boundaries to really support this work and think about the ACEs work that can evolve over the next few years, right? We know that this work is ongoing, that it's going to be part of the type of work that we're supporting as we're thinking about equity, trauma-informed care work, and really making the changes that are necessary to fight the isms, violence, systemic inequalities that families are facing day in and day out. And so with that, we want you to save the date. A formal invite will come hopefully August 1st. And so this is a free conference. You know, we're hoping to have it a plated lunch with dynamic speakers and workshops where folks can kind of think about this work in a kind of fuller day. It's also an opportunity for folks to connect and really think about how we connect with each other to really sustain and move this work forward. Because one of the biggest kind of ways to sustain work is network building and relationships that can help us move forward and really catalyze change in our community. And so with that, we want to thank you for your time. I know we started at around 90 folks in the morning, 99 folks. We're at 55, so appreciate your dedication to really support this work. For folks that didn't stay on, we'll share the recording and the PowerPoint with you all. And if you all have any questions, one of the things that we're going to do is share our contact information, but we're also looking for sponsorships to make this conference even more dynamic. And so we have a sponsorship application process. If you are interested in sponsoring at any of these levels or contributing your time in workshops, please let us know. We have a few sponsors already, but looking to create dynamic and have additional folks attend and create capacity for that. And with that, here's my contact information. Thank you so much for your time, dedication today. And we look forward to working with you on connecting with everyone as this work progresses now and in the near future.
And
Mark,
I want
any
to
other
thank,
reflections?
I just want to thank Hector. He's the one who put all this together, did
Thank
an
you, Hector.
awesome job, and just blown away. Thank you.
Good job,
Thank you,
Hector.
Thanks so much, everyone.
Thank you for
My
having
pleasure.
me.
Thank you, everyone. Mark, can you stay on for a little bit?